pregnant woman or a newborn die somewhere in the world every 11 seconds. Helga Fogstad, Executive Director, the Partnership for Maternal, Newborn and Child Health, talks about the need and urgency of bringing the voices of women and children to the fore when reforming, restructuring and reinventing healthcare.
So it's important so we know from before that women and adolescents and children are really vulnerable, and especially become even increasingly vulnerable when something as serious as a pandemic hits. But it's really important to hear from women themselves and to really share their story and their experiences. And so this report is about, getting their voices to the forefront, bringing together and being informed by lived experiences of about approximately 30,000 women and adolescents in 43 countries in Africa, Latin America, Caribbean, and India. And so to hear what are they experiencing and why and what can we do about it. So the report is five of our really lead partners, AMREF, Grâce à Machel Trust, the IPPF, the Pro Familia, the Center for Catalyzing Change, coming together and really trying to bring the voices of women to the front so that becomes a real reality.
What are some of these grave inequalities that we have seen, especially due to the pandemic?
Just to say a little bit, I mean, what they're reporting, challenges that they're reporting are impacts on mental health and well-being, to disruption of life, limits on access to education, food insecurity, loss of livelihood, lack of access to health information and services, information and limitations around sexual and reproductive health and rights, and then really increasing violence and lack of safety and reduce agencies in securing for safety. I just want to share with you, Julius, that some of the statistics here are really stark, because it's not only women, but it's inequities are being further compounded by the impact of COVID, and whose knock-on effect on women, children, and adolescents have been far greater than the direct effects. And as you can, as we see from the report, they cut across social and political and economic spheres. Now, the World Bank forecasted a 5.2% contraction in GDP, and the UN has estimated that 71 million people are being pushed back into poverty. And so services are really, it's not that they're not there, but they're not being accessed because of the pandemic. Women have had decreased access to reproductive health services because of disruptions, and reported of domestic violence has increased. So really, this is it makes the reality of this. It brings really a face to the problems at hand.
Talk to me about the key recommendations from the report, and what exactly are you trying to achieve here?
So it's important to safeguard women and children and adolescents, right? Because they're vulnerable, they're not accessing. So solutions being implemented that we have learned from and can apply are: one, economic relief measures. Women are losing their job. They're actually making decisions based on the situation of their economy. So the economic relief measures are important. They need to be targeted. Inclusion of sexual, reproductive, maternal, newborn, child, adolescent health, and also nutritional services in a list of essential services. So to be explicit about these services and provide them, Julius, that's important. And then using a range of digital tools and traditional media to maintain health and social and educational services and reach different population groups with health messages, and also psychosocial support.